Good afternoon, everyone. Thanks for being here for the latest news conference regarding the city's response to the pandemic, the local actions. I have today a PowerPoint presentation during which I'm going to highlight the Rapid City Business Reopening Plan. And just before we start, I acknowledge this will seem controversial because it is a reversal of action taken by the City Council on March 27th. But I want you to keep an open mind here until the end of the presentation, when you can then understand exactly what's gone into this plan and how we plan to execute it. So we'll start with the PowerPoint right now. First of all, I want to discuss the terminology that we have here in Rapid City with our situation. First of all, we do not have a retail closure. We do not have a citywide shutdown. We do not have a lockdown. And we do not have a stay-at-home order. So what we do have is a narrowly focused city ordinance affecting 8% of our city businesses and 11% of our employees. We also have not defined essential versus non-essential employees. So this assessment, what we have in place today, was based on a point-in-time analysis of information available to us around March 20th, so 30 days ago, roughly. The situation here in Rapid City, early March 2020, we began to see coronavirus activity around the globe, primarily China, Italy, Spain, some early outbreaks and deaths in Washington State. And based on that, we saw a number of national predictive models that were surfacing and widely available on the internet. We've also were introduced to the term social distancing and also the term the curve. So the curve being the graph that shows the peak infection rate, or some curves show the peak hospital population. But those are really the first times we started associating our response with this type of thing. Also, we started listening to the experts, Dr. Fauci, other medical professionals, the CDC, the World Health Organization, and we learned basically that between 30 and 60% of our population may become infected, that 80% of those infected would have mild symptoms. The hospitalization rate at this early point was estimated to be at 20%. And it's very logical that that was estimated using the international data, since their disease progression was much greater, much farther along than it was in the US. And of the 20% hospitalized, 5% were estimated to be intensive care patients, and nearly 90% of those requiring ventilation. So this was coupled immediately with reports of a testing and personal protective equipment shortages globally. Also, the primary threat in March was and remains a lack of hospital capacity. That remains a credible threat. So our assessment and response of this, again, early March 2020, we have a new strain of a virus. The viral behavior is unknown, so we're really not able to gather all the facts and evidence that we would like to in order to formulate a comprehensive response. We saw from the state, the governor's administration, they were using a variety of modeling available from Harvard and various institutions. And we heard early on that no closures of businesses would be considered by the state. So our early city response, we ultimately made the decision to act under the authority of state law from two statutes. one statute that allowed us to make city ordinances for the general health and welfare of our city, and the other specifically allowing us to take action to mitigate the spread of disease. Now, the second ordinance, not something that's used a lot. In fact, it was, I think, an 1890 law that was updated last in the 1930s. And it was seen at the time in that initial analysis by South Dakota's legal community, their city attorneys statewide, that the statute was very broad, which is not a standard legislative bodies shoot for when they're creating laws. So there was a lack of specific details in the statute. Nonetheless, we made the decision to act on that. The situation today, now we have data, United States data, widely available to us. We have every state in the Union and our few territories all infected with coronavirus. So we have a lot of more appropriate data sources than we did when we were looking at China and Italy and Spain. The hospitalization rate is proving out to be approximately 1/4 of what was first predicted. The Smithfield plant in Sioux Falls serves as an example. We have the benefit, not saying we're benefiting from someone else's disaster, however, 340 miles from here, we have a major employer, 3,700 people, that had pretty widespread infection and some infection out into the community as a result of that. So we get to learn these lessons being in western South Dakota today. That's very beneficial to us. We do have a slow onset of disease in western South Dakota. Our major employers here being Monument Health, Ellsworth Air Force Base, Black Hills Energy, and they have all been afforded additional time to prepare for the spread of the coronavirus. The community has had time to adjust to social distancing standards. What we didn't know the definition of 6 weeks ago now is a commonly used word for all of us. So we've got to evaluate our community on how we are behaving socially. And in a room with journalists, we have every single journalist here at least 6 feet apart, some wearing protective masks, and you see that wherever you go, in the grocery store and so on. Well, there's a lot of concern over driving down the street and looking into a city park and seeing people too close together. So we get phone calls and emails on that. And I'm just telling you that no one ever contemplated we would get 100% compliance with social distancing recommendations. That is not realistic in our society, and 100% compliance was not figured into the predictive models that are being used now. So, but we are conforming widely as a community. Our medical community and our emergency preparation has benefited from the additional time afforded to us by the slow onset of cases. So there are two sets of circumstances to justify city action. And on the one hand, we have the ordinance that was passed by the City Council March 27th. That was largely based on an analysis of international data and the curve, the threat of the hospital being overrun, which those early predictive models nearly guaranteed that our national hospital capacity would be overrun. Today, going on April 20th data, we have widespread analysis of national and local data. We know that the hospitalization rates are smaller than predicted. The ICU rates are smaller. The curve predicting hospital capacity appears to be right now in the zone where it can be handled, whereas a month ago it was not. We have more accurate predictive modeling. I'm extremely proud of Monument Health and their analytical team for putting together a group of people with mathematicians, statisticians, engineers, physicians, and others to come up with a very logical, very scientific and accurate system of predicting the viral behavior. That model, that logic is being used in the state and also in the other two major hospital systems near Sioux Falls. So we also have the ability to measure the effectiveness or the value of specific mitigation tactics, which is also done by the analytical team. That's very beneficial to understand what the actual value of wearing a mask is, or staying 6 feet away from someone, or using hand sanitizer. So also, this brings us to a conclusion 30 days later that the information we use to pass the March 27th ordinance is largely no longer valid. And so we have the evidence on our side of the community's willingness to participate and behave safely, but overall we have a rapidly changing situation, and that calls for a flexible plan for mitigation. So that's why we're here today. The scope of Rapid City's closure, or the effects of the city ordinance depicted here in this pie chart, 92% of our businesses were unaffected by that ordinance. I think that's a substantial number. You can see 8% then were affected by the ordinance. As far as all of the employees in Rapid City, 89% of those employees were unaffected by the city ordinance. 11% were affected. Now, what's important to know, and this isn't an absolute fact, it's more of an anecdotal analysis, but probably upwards of half of the 11% of employees who are today out of work, I would estimate half of those employees were out of work prior to the approval of the city ordinance because of the customer traffic slowing down so much, and or businesses making self-determination that it would be safer for them to close. Now, to switch topics onto COVID-19 testing. This is a big topic in the community. On average, in South Dakota, 1% of our counties across the state, 1% of the county populations are being tested. And in Pennington County, we're being tested, about 0.3% of our population is being tested. So this is a great point that causes concern. There's concern because by this time, many of us in the community know someone who became ill, went through the screening process, and was denied a COVID-19 test. So that breeds some anxiety. It brings anxiety from all of us watching, who says, well, how do we know? How do we know who really is infected and who isn't? And so there's a different way of thinking about this. If we had a widespread test, if there were hundreds of millions of tests available on demand, we could test our entire US population. We could find out exactly how many people had COVID-19. But in a few days, all of that test information is invalid because you could have contracted it in the last few days. So you would need a test every week or two to really see who has it, and if you're one of those 80% who are going to have mild symptoms. So the tests, based on the global testing supply shortage, the tests are accompanied with the screening mechanism, and they are designed to follow the viral activity and the symptoms in our state. So that means when we have some outbreaks in Sioux Falls or in Brown County or Beadle County, that's where the majority of the testing is going to occur at that time. And in concert with the Department of Health investigation to try to track how many people may have been affected, how many people should be quarantined. So there's a lot going on behind the scenes that we don't see, but the tests follow the viral activity. So the notion here is that widespread testing at this moment is neither appropriate or possible under the circumstances. So we just have to resign ourselves to the fact that the rate that we are being tested today and the methodology that's being used to select subjects to be tested is not changing anytime soon. So by this time next week, we will not have all had a COVID-19 test. We are going to continue to fall into this medical screening process, and those who screen appropriately will be tested. Others will be asked to self-quarantine at home. So the number of COVID-19 hospitalizations in our areas, in our regions, either support or refute the notion that the tests are following the viral activity. So, for example, hospitalizations in our area, virtually non-existent for COVID-19 patients, whereas East River, there's quite a few in the hospital today and that have been in the hospital on the eastern part of our state. 111 to date having ever been hospitalized, and the number hospitalized today, several dozen. So that helps support, in my opinion, that we are not widely infected in Pennington County or in western South Dakota. If we were, we would be seeing those hospitalizations in our local hospitals for COVID-19. And if you're someone who is ill and you go to the hospital with a respiratory distress of some kind, you're going to receive a COVID-19 test. That's absolutely the way it is right now. So we just don't have those positive tests of people in the hospital. We don't have that activity. So I'm just recommending that we stop worrying for the moment about the testing rate and start trusting the medical community more to assess the activity of this virus in our communities. So the point to all this is that modifications are needed to our city ordinance that we passed at the end of March. The situation has certainly changed, and it's time for our actions to change to ensure uniform social distancing implementation throughout the community, to help reduce risk in light of the currently restricted businesses preparing to reopen, and ultimately to protect access to life-saving hospital resources. That's why we need to take modifications here. The curve in western South Dakota and in Pennington County today is flat. There is no curve, it's a flat line, and it can't get any flatter. And it is flat not solely because of the 8% of businesses that have been closed. That 8% of that business activity being closed has not led us in its entirety to be a flat curve. It is an accumulation of community participation, the safety measures that we have taken, and the safety measures that businesses all over the city have taken upon themselves. The next logical step is to balance the threat of this virus with the threat being created by a faltering economy. Food security is decreasing among the low-income population. That means the demand for food assistance is going up. The food supply to the local nonprofit distributors is at risk of decreasing. The various meatpacking plants closing around the nation have already disrupted the supply chain, and we fear there are signs, visible signs, that we will start seeing a shortage of food made available to these nonprofit distributors. Our duty, I think our obligation, our ethical obligation, is to try to avoid a collision of the demand increase and the food supply decrease. Where possible, part of the cure here for the food the food supply is where possible those out of work should return to work to become self-sufficient again. So here's the new proposed restrictions. There's 4 pages of proposed restrictions, and it's important to know, to create a visual in your mind of how this is going to happen. Let's just imagine that the first step here is to release the restrictions against this 8% of the businesses, to lift those restrictions. So no longer will restaurants, bars, fitness clubs, casinos, arcades, and all of those described in the ordinance, no longer will they be closed. Now the second step then is to apply a set of regulations that we can implement not just on that 8%, but on 100% of Rapid City businesses. And that sounds like we've gone from having a significant presence of government intervention in people's lives to an astronomical level of government interventions. However, when you see the restrictions, you're going to see, and if you've been out into the retail market at all since it started, you're going to see that there are a number of businesses who are already today compliant with the new restrictions, many that are nearly compliant, but no one is ignoring safety measures out in the retail market. So the weight of the new restrictions will not be that great, considering there are many already taking measures to keep their customers safe. So as we go through these, just keep in mind these are almost in random order. This is not a draft copy of the resolution. The city attorney's working on that. We'll have that in the next day or two, where they'll be in better order. Okay, so these are just a splattering of these new restrictions. A minimum 6-foot space between tables, chairs, and bar stools. Capacity limits in restaurants, bars, and casinos to 10 people or 1 customer every 125 square feet. 125 square feet are what all of you in this room right now are claiming as your own. That 6-foot circle that goes all the way around you, that's your space. And so we're mandating that that space be allowed to customers as well. Require hand washing at regular intervals for restaurant and bar employees. Food service employees must be masked. Video lottery machines clean and disinfected between each customer. Customer seats in businesses and theaters where they have crowds, audiences, to be marked as not available due to social distancing guidelines. You could say, well, we could just remove some seats. Well, I think we'd prefer to leave 1 seat accessible, tape off 2 or 3 to get this 6-foot distance, and place a sign on those that it's due to social distancing guidelines. We get some refreshing in our minds of the purpose for all of this. Approved public health announcements once hourly in retail stores larger than 50,000 square feet. And we'll have some samples of that. It's very basic, but it's just to include how customers should behave while in the store as far as social distancing goes, and also an opportunity for stores to tell you what they have done to keep you safe as customers. Posting of regular cleaning and disinfecting schedules specific to each business. Hand sanitizer locations throughout retail and grocery stores readily available for public use. Requires social distance spacing while waiting for service or entry into businesses. Enhanced cleaning and disinfecting requirements for motel and hotel rooms. Exercise equipment and/or mats cleaned and disinfected between each customer. Seating for large gatherings reduced to comply with a 6-foot minimum distance between attendees. Clearly marked one-way shopping aisles in grocery and retail stores. There are many stores trying to get this done now with tape on the floor, and my own observations have been that it's we need more help being reminded which way is the one way in a store aisle. Limit the number of customers in grocery, retail, recreation, and fitness businesses based on available square footage, 1 customer for every 200 square feet. plexiglass dividers between cashiers and customers where physically possible in retail and grocery businesses. Many have those up at this moment. Hair and nail salons, barbershop employees to be masked during customer contact times, and customer seating must be 6 feet apart. Public social gatherings limited to 10 people. We will encourage public masking whenever possible, encourage daily employee screening, and ongoing strict social distancing policies to protect the elderly and those most at risk. And here's some odds and ends that go along with those restrictions. City facilities will be handled separately. If and when we open park, playgrounds, tennis courts, basketball courts, city buildings, we will do that outside of this ordinance. None of the new regulations take the place of safe practices, primarily social distancing. In fact, we're trying to make mandatory social distancing. And high-risk groups should continue to stay home whenever possible. Take extra precautions if they have to go outside. And no one knows who the high-risk group is better than those in the high-risk groups. Enforcement. Rapid City Code enforcement will lead this effort, and the emphasis will be on education and also voluntary compliance. We're not looking to flex our muscle here and get anyone in trouble for not being 100% in compliance, but we would like to work with the businesses to achieve compliance across the board. Future risk mitigation. I've just told you about a plan that needs to change because of the changing threat landscape. So this ordinance must be as fluid as the problem being addressed. And that is an unconventional approach when we're talking about a city ordinance. Typically, city ordinances are put in place. They stay in place for decades or centuries. This particular one will need to remain flexible. And that's because these are unconventional times. We're going to learn all we're going to learn about this virus over the next year, and that'll be the best time to judge whether we've done a good job or a poor job trying to mitigate it. Community outreach. We would like businesses with questions or comments to email those to the mayor's office at mayorsoffice@rcgov.org or to call 394-4110. Or you may submit a message for public comment for the upcoming public meetings by going to our webpage, which is rcgov.org/COVID. And now I'll take any questions you may have in the room.
So if you media has any questions for the benefit of your viewers, just let me know and I'll get you the microphone.
When requiring businesses to wear masks, like you mentioned, masked food service, requiring plexiglass, needing those additional items, how do you work with businesses who might be struggling financially to support those goods?
Well, that's a great question. We had, to this point, had only thought about the businesses that may be struggling with the supply of some of these items. So we have Elevate Rapid City has convened a group to work on supply chain, and I think we would be very flexible in helping to procure those essential items that may be needed. There's going to continually be a shortage of masks and perhaps gloves and that sort of thing. So understanding all of that, we need a common sense implementation of the ordinance.
Nathan Thompson with the Rapid City Journal. The City Council will be meeting on Monday to, I'm assuming, look at this resolution. Is that correct?
Correct. The City Council will meet this Monday night, this coming Monday night, with this one item on the agenda to discuss adopting a new plan a new amendment to this ordinance. And should they approve this, it will be effective immediately. Now, understanding some of these businesses, it took some of these businesses days to close down with the inventory they had and that sort of thing, so it's going to take some of them days to get started back up again, but it'll be effective right away.
As like some parks, right now are just packed with cars and whatnot, with a businesses kind of having a little bit less restrictions, wouldn't it be harder to like bigger families of more than 6 or whatnot come into these places? How would you handle something like that?
Well, families or people who live together are going to obviously have to be the exception to the social distancing standards. If you live with someone under the same roof and you go into a restaurant, it's illogical to make you sit 6 feet apart. So we will be relying on the honor system to some extent. I would hope people who only work together or know each other casually would be a little uneasy penetrating that 6-foot gap and would comply with the ordinance.
So this does not need a second reading?
This will not need a second reading because it is a resolution and the ordinance will be modified by resolution. That's the way it is. And technically, to be legal, it requires publication, which would occur either on Tuesday morning or Wednesday morning. However, the action being taken is primarily to lift the restrictions on the closed businesses, and so in effect we can do that by not enforcing opening on those.
And I also understand you mentioned that you were going to take this to council members one by one. Have you started doing that? And
I did.
what's the reception?
I've been through all of the council members at this point. There's wide support for it. I've also had some feedback from local area physicians who want to know more, and I've explained that. They're very very supportive or very understanding about the process that we're going through. And it's, I've taken the quick presentation route today. There's a lot that goes into this decision. The alternative to not lifting these restrictions because we don't feel safe is to wait until the entire country is safe until we restrict them, which could be a year, could be longer, and we may as well buy plywood and board up a lot of these places. So there is a consequence to unnecessarily imposing an ordinance like this when the evidence at the moment doesn't suggest it. I do believe that we have a good early warning system through those who produce the predictive modeling and can let us know weeks in advance what the new trends are, and that if need be, the council can take action, modify this ordinance again for the protection of our citizens.
Just a point of clarification on the capacity limits in restaurants, bars, and casinos. You said limited to 10 people or 1 customer. So if they have a larger facility where they can maintain 1 customer for every 125 square feet,
Yeah.
does that mean that they can have more than 10 people in their establishment?
Yes. A restaurant that has 4,000 square feet, for example, could have 32 patrons. All of them would be sitting 6 feet away from each other. Now, whether or not the configuration of the restaurant would allow that is a whole other thing, but we're working with some restaurant owners now to use their restaurants as examples on how to rearrange seating. And frankly, some of the restaurants have spoken to me and said they won't reopen based on these new regulations because the difference between having no customers and having just a few customers is not significant enough to justify opening up to all that overhead and risk. So they will wait until, for the time being, until the next action may be taken down the road.
Will this resolution be similar to the current ordinance that we have in the fact that it would only be done 2 weeks at a time? Or is there an expiration date that you are foreseeing on this resolution?
Good question. It would be similar. The council will set when to review this. I think it would be safe to review this not every 2 weeks, but perhaps once a month. The ordinance itself has an expiration date, I believe, of June, so that'll have to be revisited and renewed if we're going to continue beyond that.
I have a question a little different. Monument Health furloughed 200 employees, 25% pay cut for management. Are you thinking of doing anything similar, any type of pay cuts or furloughing any of your city employees?
We have budget planning underway right now. We've estimated our revenue for the city of Rapid City will be decreased by about $7 million in 2020. So we're going through the lists now, meeting nearly every day, to find the sources to make up that revenue. Some of them will be employee expenses, whether that's not filling vacancies or encouraging retirements or furloughs or layoffs. That's inevitable. And then going into 2021, now's the time for us to be constructing the 2021 budget. So looking out that far, we're predicting about a $3 million loss in revenue for 2021. So we have 2 projects going at once to get our 2020 budget in line and to prepare the 2021 budget for approval.
Any other questions?
Okay, well, thanks everyone for being here. Appreciate it. The presentation should be up on the website later today, I would expect. So, thank you.